Good evening. My name is Manuela Staneva, and I'll be presenting a study by the Mississippi State Department of Health. The study's title is COVID-19 Pediatric Emergency Department Visits in Mississippi. The objectives, this was a retrospective analysis of Mississippi's pediatric ED visits related to COVID-19 that occurred between April 2020 and September 2021. Only patients with a primary COVID-19 diagnosis were included in the study. We had three objectives. First, to examine the trend in pediatric COVID-19 ED visits and measure the length and height of each wave. Second, to compare the demographic and clinical characteristics of pediatric ED visits with and without COVID-19 diagnosis. And lastly, to evaluate the predictors for emergency care among COVID-19 pediatric patients. So the first goal was to measure, or first identify and then measure the waves. For this purpose, we stratified the trend line into time series of 7 days. If the 7-day moving average increased or decreased by at least 20% compared to the previous 7-day period, we marked the beginning and the end of each wave. You can see on this slide that Delta was a huge wave. And also you can see that the very first wave was not visible, but the rest were well defined. The second wave lasted for 55 days. The next one was 105 days, and the fourth wave, or Delta, was for about 92 days. The majority of such visits, 60%, occurred during the Delta wave. The median daily number of pediatric COVID-19 visits was 12 during the second wave, 18 during the third wave, and 56 during the Delta wave. The baseline was 3 visits a day. The baseline is the time period between the waves. Demographics, there were 9621 pediatric COVID-19 ED visits in Mississippi during the study period. Of those, the vast majority, 65, were African Americans, 59 lived in non-urban areas, 51 were in the 0-11 age group, and 54 were females. Also, 78% were insured by Medicaid. Predictors, the multivariable regression model uncovered that the strongest predictor for COVID-19 ED visits was older age, followed by African American race and Medicaid insurance status. Conclusions, our research accomplished 2 important goals from a public health perspective. First, we were able to establish a baseline number for daily COVID-19 pediatric ED visits. As COVID-19 transitions from pandemic to endemic, change in such baseline data can be used as an early warning indicator during future waves or seasonal surges. Second, our study uncovered a high prevalence rate in the state of COVID-19 pediatric emergency care use among Medicaid patients. These findings suggest that a significant proportion of the children who receive emergency care for COVID-19 are from poor households and may lack primary pediatric care. And this marks the end of my presentation. I would like to thank my co-authors, Dr. Thomas Dobbs, State Health Officer for the state of Mississippi, and Dr. Kenan Smith, who is a pediatric consultant with the health department. Thank you.